So we're talking about hip replacement surgery. I want you to walk over, if you don't mind, to
Sure,
the 3D
absolutely.
image of a hip fracture. And doctor, correct me if I'm wrong, but this is a hip fracture, correct?
This is after
Okay.
we've treated the hip fracture.
So tell me how it's treated and what we're looking at right now.
Okay, so first we'll start off with this model, and let me just start by saying I just finished talking about hip replacement surgery and how remarkable it is. The vast majority, and the reason why I'm here is because I'm a surgeon, but the vast majority of patients with arthritis are treated without surgery. And surgery is really what we do when we haven't been able to, after sometimes years of conservative treatments, to be able to treat the pain and treat the inability to get up and move. And what results is surgery. Now, this particular situation can happen either for arthritis, but it's also a very similar treatment when someone breaks their hip. And this in particular is similar to the types of hip replacements we put in for arthritis. There are some subtle differences, but basically what happens is it's very common for a patient to break their hip at what's called the femoral neck. And the neck of the femur, which is really the connection between the rest of the femur and the ball and socket that's moving, that's where it breaks. And that's a really, really tough place to heal. It's practically standard for the vast majority of patients now for us not to even try and get that bone to heal anymore. Why? Because it will take months to heal, and all that time you'll be on crutches in a wheelchair and not moving. And like I said, the most important thing to do when you get injured is for me to be able to get you to start moving. And so this replacement really allows you to get up right away. It holds you up, it's stable, and it's an implant that restores your stability and your mobility right away. And that's how we get people to start walking, sometimes even the same day.